Anybody else tired of that phraseology? Oh, well, we all know that the V words are safe and effective, because if you didn't know, they're safe and effective, and we're going to keep telling you they're safe and effective. It's kind of like artery clogging saturated fat. Like if you say something often enough, people actually believe it. But is it true? Safe and effective. The fact is that clinical testing of this V word is not yet complete. The requisite phase 3 clinical testing, which kicked off April the 29th last year, it's still happening. Did you know that? The Pfizer V word, the phase 3 clinical trial, before that's done, we're already jabbing people in the arm like crazy. But the phase 3 trial is not finished yet. The estimate completion date for primary outcomes is July the 30th of this year, while monitoring of secondary outcomes isn't supposed to end until January 27th, 2023. Guys, we're 2 years away from the completion of the phase 3 clinical trial. So can somebody please tell me why, pray tell, we are jabbing people in the arm out in the real world if the clinical trial that is supposed to confirm whether it is safe and effective has actually been completed yet? It hasn't. Why doesn't the public know this? Why is the public so trusting that this quickly rushed V word, faster than any other in all of human history, is completely safe and effective? Why would they believe that? Because they've been told that, probably. Under normal circumstances, satisfactory completion of phase 3 clinical trials is a prerequisite before you get any kind of approval for a drug. That's why the drug required the loophole of emergency use. So the only reason they're using emergency use right now is it would not pass the muster through the normal processes of phase 3 clinical trial. So if you joined us late, we're talking about, and we're reading from an article from this guy, Anthony Colpo. He's a science-minded citizen journalist down in Australia. Loved his work for years, talking about cholesterol and saturated fat. He's tackling this 9-1 DIVOC V word, and what are we going to do if people start dying from it? And they are. So he's getting into the nitty-gritty of it. So they had to use emergency use authorization to get it to the market. Despite all disingenuous claims to the contrary, this drug has not yet been fully tested. Now let me ask you guys. We know this is true. We know there's no way it's been fully tested. Typical clinical trials on a V word generally take, for animal studies, which were non-existent in this V word, animal studies can take about 6 to 12 months. Okay, and then you move to phase 2 trials where you do a small part of the human population just to see how it works on minimal people, a few hundred people. That can take anywhere from 2 to 5 years. And then phase 3 clinical trials typically can take upwards of 5 to 15 more years after that. And we did this in 10 months. So it's all out there. So now, part of this phase 3 clinical trial, that whether people know it or not, if you're getting jabbed in the arm right now, you're a part of that phase 3 clinical trial. But the problem is the data from what's happening to people out in the real world ain't going to be a part of the actual trial. It's just the people in the trial. None of this bodes well for public health, because even drugs that go through this full approval process already have a high likelihood of producing serious side effects. Researchers at the Yale School of Medicine found nearly a third of drugs that had been approved by the FDA from 2001 until 2010 had major safety issues years after the medications were made widely available. 71 of the 222 drugs approved during the decade have now been withdrawn, requiring a black box warning on side effects or warranted a safety announcement about the risks. It took a median of 4.2 years after they got full approval for these safety concerns to come to light, the study found, and the issues were much more common amongst those psychiatric drugs out there, drugs approved the regulatory deadline for approval, and biologic and drugs that were granted accelerated approval, like this 9,1-divoc V word. There's another problem with this main ingredient in the Pfizer V word called Comirnaty. Not only is the phase 3 testing incomplete, but the 9,1-divoc V word uses technology that is new and unproven and therefore of unknown safety and efficacy. And you've heard me talk about this one a lot. I did several Jimmy rants all about this. Is the very first mRNA, messenger RNA V word ever to be administered to humans. In fact, Moderna, which is one of the two in America being injected into people, either the Pfizer or the Moderna. Moderna is this is their very first drug. They've never made a drug before. This V word is the first one they've ever done. And Moderna literally stands for modified RNA, Moderna. That's how they came up with that name. They're so different, these mRNAs. Most influenza V words are made by growing weakened forms of the target virus inside of chicken eggs. Fluid containing the virus is then harvested from the eggs. It's then purified, filled into vials, along with other questionable ingredients, and then shipped off to be injected into the unquestioning masses who get a dead, inactivated form of the virus. This is the most commonly used method that's been used over the last 7 decades. More recent additions to the flu V word arsenal include nasal spray flu V word called Flu Mist, which contains a live but weakened virus, and then V words produced using cultured mammalian cells instead of eggs. And then there's this other one called recombinant V words, made by combining DNA for making this thing called hemagglutinin, a surface protein and antigen found on influenza viruses, with a baculovirus and a virus that infects invertebrates. The resultant recombinant virus is introduced into host cell lines, which are instructed by the hybrid virus to produce the antigen. This antigen is then grown in bulk, collected, purified, and then sold as the V word for the flu. The premise behind V words is that your immune system has white blood cells that will recognize unwanted intruders by those antigens. By giving someone a V word containing antigens for a virus, your B lymphocyte cells can then make antibodies. If that person is later infected with that virus, then the antibodies already present will attach to the pathogen and tag it for termination. So that's the normal way that a V word works. Let me be very clear. I'm not anti that. If that's what this one for 9,1-divoc was all about, I would be all for the V word. That's not what the one for 9,1-divoc is all about. People are like, whoa, we've had V words before. Yeah, it's different. You've had a hamburger before, but if I served you a shit sandwich, would you like it as much as the hamburger? I don't think so. Why? It's a hamburger. I told you it was a hamburger. It looks like a hamburger. Oh, you mean it doesn't taste the same? It's not the same? Well, the same goes for the 9,1-divoc V word. It's not the same as all those others. So those people, it's like, we've had V words forever. It's no harm. I know some people have gotten injured by even those other V words, but let's set that to the side for a moment. This new one is a far different technology is the point. So that's a brief rundown of what the world of flu V words looked like prior to 9,1-divoc, but as the world collectively shat its pants over a virus with an infection fatality rate of less than 0.5%, a bunch of billionaires and their politician friends decided we need a new V word, and yesterday, damn it. So they picked up their phone, they called their buddies at Big Pharma, they told them what they needed, and that time was of the essence. There was huge money to be made. I mean, lots of lives to be saved. But they had to strike while the iron was hot before the virus mutated into 1,2-divoc or 2,2-divad or 82Z-Accor or some other stupid vanity plate named pandemic. And this is where the 9-1-DIVOC story takes an interesting turn. Listen to this. While AstraZeneca, a corporate criminal just like Pfizer, went with a traditional V-word approach, companies like Pfizer and Moderna opted for the high-tech approach. The latter made the decision to run with a once-dismissed technology involving synthetic messenger RNA, mRNA. The typical government mainstream media explanation of these V-words with mRNA say that they teach our cells how to make a protein that triggers an immune response inside our bodies. That immune response, which produces antibodies, is what protects us from getting infected if the real virus ever gets in our bodies. That's what they're telling people about these mRNAs. So in this rosy cheek version of events, mRNA V-words are like, dear old Mrs. Appleton, your sweet first grade teacher who taught you to count to 10 and tell the difference between the letters C and K even though they sound almost the same. mRNA V-words are being made to look as helpful, benevolent, and non-threatening as they possibly can. But based on what we now know, it's much deadlier than that. So Anthony gives a nice little overview of the history of mRNA V-words. The kind of paper, it sounds great on paper, right? mRNA V-words. The kind of paper that compromises a company prospectus. The body uses mRNA to instruct the cells which proteins to make. Sounds all nice, right? In theory, you could design your own mRNA. You can manipulate the process, create proteins to V-word against infection, rare diseases, and repair damaged tissue. The early pioneer of this technology was a Hungarian-born scientist, Katalin Karikó. According to various media stories, her early belief in the potential of mRNA to fight disease was not shared by various governments, corporate funders, and even her own colleagues. Her mRNA quest proved something of a career dead end as she struggled with getting rejected and demoted all along the way, until 9-1-DIVOC entered the scene. So the stumbling block was that injecting a synthetic mRNA often backfired and it caused an unwanted immune response. We talked about this before on previous Jimmy Rants. These mRNA V-words, they're injecting something into your body that once it enters the body then gets confused about what's the intruder and what's not, because it contains things in it that mimic something that's in your body naturally. So what does the body do when it sees the natural version, but it thinks it's this foreign intruder? It starts attacking. When the body attacks itself, that's called autoimmune disease. This is why certain people are having certain reactions. And this is why we need many years of people taking this jab in the arm before we see what kind of reactions people are going to have. We just don't know yet. The body senses that foreign intruder and attacks. Turns out one of the RNA nucleosides in its altered synthetic form was throwing everything off by triggering the immune system. So what they did was they modified that original RNA nucleoside and they made a hybrid mRNA that could seemingly sneak its way into cells without the immune system kicking in. Well, under the experimental conditions in the lab, it did. This discovery was first published in 2005. While it largely flew under the radar, it did catch the attention of Derek Rossi, who would be one of the founders of Moderna. Rossi and his partner started Moderna in 2010. Internal squabbling had him leave the company in 2014, but the mRNA concept he introduced stayed behind. Under its brash and entrepreneurial CEO, Stephanie Bancel, Moderna went on to raise billions of dollars. They went public 3 years ago in 2018. Its promise to investors relied on a range of mRNA medicines that could be safely dosed over and over. What I want to know is Moderna came on the scene in 2018. Why did it take 9-1-DIVOC before they created their first drug? And if 9-1-DIVOC had not come along, what would have been their first drug? Like, is this not all intriguing to you that this company pops up in 2018